Welcome to session number 12. As I've mentioned before, you are at the place where it is not possible to go over every single handout in your booklet each day. The secret here is that what you cover must be individualized for you. At the Social Anxiety Institute, I ask what areas are still causing you the most problems. Almost everyone feels they need to keep working on the ants handout, so the realistic beliefs about automatic negative thinking become stronger. Some people have a hard time with the fighting paradox and the acceptance concepts, so it is good that they emphasize those. Still other people do not yet believe the deserving statements or moving in a positive direction statements. If this is the case, then these are the handouts that should be read over daily. Don't allow yourself to get off track at this point. What handouts from the past weeks are still not fully believable to you yet? These are the ones you should keep reading slowly, dropping the message down into your brain. It is also a good idea to keep going over some of the handouts that may be just starting to work for you or just starting to be believed. The more they can be repeated and reinforced into your mind, the better. So pick your handouts from the past weeks with these thoughts in mind. And congratulations for keeping them up, because by this time, and we know this from hundreds of other people's experiences, if you have been faithful in reading over your handouts out loud in slow talk every day, some of them are beginning to work for you already. These are usually very exciting weeks in therapy, as the person notices that their thinking is beginning to change for the better, and their willingness to do things they would not even consider before is growing stronger. This week, the first new concept we'll work on is called Anxiety is a Paradox. Act against your negative feelings. This is one of the more difficult concepts to master, but all it really takes is getting started. Once you get started, once you've made that first step, everything becomes easier, and your positive emotions and positive feelings will follow afterwards. You will even be able to notice and feel the difference. We tend to forget that our feelings do not tell us the truth. Stated a different way, our feelings are sometimes irrational, just like our thoughts. We tend to realize that our thoughts can many times be irrational, while our feelings can be irrational too. For example, why did I used to get nervous, anxious, and depressed when someone suggested that I make a speech? This was just a suggestion, and I didn't really have to give one. But just the thought of making a speech turned my stomach raw with fear and brought on all those negative thoughts. Why? My feelings were being irrational. They were lying to me. Since I didn't have to give a speech, I obviously did not need to start feeling anxious and nervous. Even my self-consciousness would increase. But these feelings were not based on fact. They were liars. It did not make any sense for me to become anxious over something I didn't have to do. My response should have been to stop the automatic negative thinking, label it as a pathological liar, and question my feelings that had spun out of control. I could have done this by slowing down, taking a deep breath, and loosening up or relaxing. Another good example of acting against your negative feelings is cognitive therapy for depression. When someone is clinically depressed, the hardest thing for them to do is to get up, get active, exercise, and move around. Yet we all know the solution to depression: get up, do something, exercise, move around. The solution to depression is not to stay in bed and dwell on those old negative aunt's thoughts. The solution to depression is to act against your negative lying feelings. If you act against these feelings of depression by getting up and doing something, you will feel better as the minutes go by. Activity is the antidote to depression. But when we are depressed, we don't want to be active. This is what makes it a paradox. You do something you don't feel like doing at the time because you know if you do it, you will feel better. Again, this is a real paradox and explains why both anxiety and depression are so difficult to overcome. The solution is to do the thing you feel the least like doing. Anyone who is depressed does not feel like getting up and becoming more active. But it is the solution. It does work. Your feelings and your thoughts improve with activity. It works because overcoming anxiety and depression are both paradoxes. If you are nervous and scared, the hardest thing to do is to get out there, go to work, be active, and keep up with your responsibilities. But even though this is difficult, what is the solution to anxiety? Getting out there, doing what we need to do, and facing our responsibilities. This, of course, is another paradox. The solution is to do the thing you feel the least like doing. Anxiety and depression have you trapped if you don't act reasonably against them. The emphasis here is on reasonable and rational. Keep in mind we need to gently, step by step, work our way up the ladder. We don't choose an activity that is a highly anxiety-causing situation to start with. Starting with an activity that frightens us to death is not reasonable or rational. So we choose something that does cause a little anxiety, and we do it because we know it will help us to get better, if we keep our thoughts rational about the activity we are doing. For example, I found it anxiety-causing to walk around the block when I was stuck in social anxiety. I feared that everyone was looking at me from behind their window curtains, and they somehow disapproved of me or didn't like me. Because I was so self-conscious, note that this means I was focusing internally on myself, which is not a good thing to do. I felt I couldn't even walk correctly, and that people were judging me about that too. You know how irrational thoughts can lead to other irrational thoughts and can fuel the fires of social anxiety. If walking around the block is difficult for you because of social anxiety, then take that first step, walk out on your doorstep, and act against your negative emotions. Just by your commitment to getting better, by walking out to your doorstep, you have begun to get better. The next step is to have any of the rational statements you have been working on running through your mind. It may be a rational thought, such as, I didn't used to think I could do this, but now I find that I can walk down the block at least a little ways. I am okay, and that is progress. I should pat myself on the back. Or, you could use the attitudes and the deserving statements. For example, you could say to yourself, I have every right to walk down the block like anyone else. So what if people are looking at me? Rationally, I know I have over-exaggerated this in my mind. But even if everyone was looking at me, so what? Who cares? They must lead pretty boring lives to be watching people walk down the block. The key is to use any of your rational statements that fit the situation and work for you. You do not need to remember all of your therapy. All you need is 1 or 2 rational statements in a situation like this to remind yourself of the truth. But with the rational statements, you must act, you must go, you must walk around the block, or partway around the block if you are doing this in a step-by-step manner. You did not feel like walking around the block. In fact, walking around the block was anxiety-causing for you. But to work against the anxiety, what we need to do is act against our negative emotion by doing the very thing we think causes anxiety. Yes, walking around the block may be anxiety-causing, but unless we act rationally against it, how are we ever going to overcome social anxiety? So we choose to act against our negative emotions by doing something. In this example, I choose to walk around the block because this causes me some anxiety. By choosing to do this, and by deliberately using my new cognitive thinking, I am putting the cognitive together with the behavioral, and I am acting against my negative emotions. By doing this slowly, in a step-by-step hierarchical fashion, I am making definite progress against my social anxiety. Because as I move forward, step by step up the hierarchy, I will be doing things that are progressively more difficult. However, because I handled this the right way and kept walking around the block using my cognitive rational statements, there comes a point where just walking around the block no longer causes anxiety. It's no big deal. But we need to work our way up to this point systematically, slowly, step by step, using our cognitive, rational thoughts. If you continue to act against your negative emotions, you will continue to eat away at your social anxiety. And the more dents you can kick in the vicious cycle, the quicker your progress will occur. There will always be times as you get better when you feel like you're not making enough progress or that you've fallen down into the ditch. But what's the solution to a setback like this? It is acting against your negative emotions. You must take that first step, no matter how difficult it is, and you must use rational